Hello, welcome. Thank you so much for taking time out of your busy day to learn a little bit more about the Stay Well grant program. Today we'll be talking specifically about uplifting our senior community and mental wellness information and resources for older adults during the COVID-19 pandemic. My name is Erin Wallace. I'm the lead outreach specialist with the Stay Well grant program, and I'll be with you for the duration of this program. I have worked with older adults, both directly and on behalf of for about 20 years. So I'm excited to share this information with you today. As mentioned, this initiative is funded through a grant from FEMA to provide counseling support to Michiganders during the COVID-19 crisis. This grant is managed by the Michigan Department of Health and Human Services. Today, we'll talk about some information related to COVID. I'll give you an overview of what the Stay Well program is, and we'll also talk about some information and resources that are specific to older adults during this time. People with COVID-19 have a wide range of symptoms that are reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. For older adults, their symptoms may be different than those of younger populations. COVID-19 is typically signaled by 3 symptoms: a fever, incessant cough, and shortness of breath. But older adults, the age group that's at most risk of severe complications or death from this condition, may have none of those characteristics. Instead, seniors may seem off or not acting like themselves, especially early on after being infected by the coronavirus. They may sleep more than usual, or they may stop eating. They may seem unusually apathetic or confused, losing orientation to their surroundings. They may become dizzy and fall. Sometimes seniors will just stop speaking or simply collapse. The reason has to do with how older bodies respond to illness and infection. Here on the screen are many different ways and options that you can protect yourself and others from the coronavirus. These are really the most common and the most easy to implement ways to protect yourself. Who's at an increased risk? We know that older adults are a high-risk population, as are individuals with the above-mentioned pre-existing conditions. We also know that in the US, the CDC reports that 8 of 10 COVID-related deaths is a person over the age of 65. So being careful with this age group is certainly very important. In June of 2020, because of concerns about COVID-19, there was an estimated 41% of US adults that had delayed or avoided medical care, including urgent or emergency care, as well as routine care. Avoidance of urgent or emergency care was more prevalent among unpaid caregivers for adults, individuals with underlying medical conditions, as well as Black adults, Hispanic adults, young adults, and persons with disabilities. Dr. Pines is the Michigan Department of Health and Human Services Medical Director for Behavioral Health, and she shared this quote with us. Emerging or lingering anxiety, distress, irritability, and loss of hope are important feelings to recognize in ourselves as well as others, and it can help to talk to someone. If it's helpful, the counselors can provide callers with referrals to local mental health agencies and substance use disorder services. The Stay Well Project is here to help everyone that's currently being affected by the pandemic. The COVID-19 pandemic has created a state of disaster in our communities, leaving lives changed and futures uncertain. Even if you've not suffered directly from the coronavirus, no one who experiences a disaster is untouched by it. For many, a disaster continues as a very real presence, even long after it has passed. Feelings of sadness, depression, frustration, anger, and anxiety are common, and it's not unusual for these feelings to last for many months. Learning to recognize the normal reactions and emotions that occur can help you better understand these feelings and become more comfortable and effective in coping with them. As an older adult, you probably have had many of these reactions and feelings. However, some may be intensified now. It's important to ask for support when you need it. Stay Well Counseling Services are here to help you 24 hours a day, 7 days a week, 365 days a year. So if you're finding that you're noticing these feelings of stress and anxiety, please call the Stay Well line. We would love to speak with you. Health is not defined only as your physical well-being. Health and wellness is multidimensional, and it includes physical, emotional, career, intellectual, environmental, spiritual, and social. Each one of these dimensions are a part of your quality of life, and if one is neglected for a period of time, you may see a negative effect to your overall health. Today, we're going to focus on 3 of the 7 dimensions of health. We'll focus on the social, physical, and emotional aspects of health. Since March, I think it's fair to assume that we've all experienced a roller coaster of emotions. For older adults, when there's a decrease in social activity, you typically see an increase in loneliness. Loneliness was first identified in the 1950s by a psychiatrist named Frida Fromm-Reichmann and is defined as the difference between someone's preferred and actual social relations. Older adults have certainly been the focus of this research for many decades. Typically, when you see a decrease in social activity and an increase in loneliness, you will most likely see a decrease in physical activity. The saying, if you don't use it, you lose it, can certainly be applicable to older adults. Typically, people move more when they spend time with others. In a time of increased social distancing, we're seeing people's physical activity decrease. Some statistics are reporting that about 38% of decrease in physical activity worldwide since the COVID-19 pandemic began. With that comes an increase of complications, one of which is depression. It's important for us to acknowledge the restrictions that COVID-19 has brought on visitation and the isolation restrictions have caused. This is nobody's fault, but the result is that many people may feel especially isolated and lonely. If you feel this way, call the Stay Well Counseling line to talk to someone about how to cope during these extraordinarily difficult times. Even before COVID-19 began its global spread, millions of people were already what researchers considered to be socially isolated, which is separated from society with few personal relationships and little communication with the outside world. In 2017, Health Resources and Services Administration completed the loneliness epidemic, which was a study on older adults, and their loneliness findings are listed here on the screen. To put this into perspective of what a physical health risk loneliness is that it's more dangerous than obesity and as damaging as 15 cigarettes a day. With social isolation measures in place in much of the world, loneliness has become a familiar facet in everyday life. Research that was completed by Louise Hockley, she's a PhD from the University of Chicago, has shown that loneliness increases risk for depression and anxiety and heightens feelings of stress, factors that contribute to worsening physical health, poor health behaviors, and including substance abuse, poor nutrition, and more sedentariness, as well as a poor sleep quality. Although it's really hard to measure social isolation and loneliness precisely, there is strong evidence that many adults aged 50 and older are socially isolated or lonely in ways that's putting their health at risk. The following is what we know about how else loneliness affects older adults. Social isolation significantly increases a person's risk of premature death from all causes, a risk that may rival those, as again, of smoking, obesity, and physical inactivity. We're seeing this definitely in long-term care facilities. People are reportedly doing well during some shifts, and by the 3rd shift, that person has then passed. Social isolation was associated with about a 50% increased risk of dementia. The Alzheimer's Association has excellent resources to help distinguish between age-related cognitive changes and potential progressive neurological disorders such as dementia. The National Institute on Health also has a few items listed to help with cognitive changes, one of which is really encouraging folks to remain social if they're noticing changes within their cognition. Poor social relationships, characterized by social isolation or loneliness, was associated with a 29% increased risk of heart disease and a 32% increased risk of stroke. Loneliness was associated with higher rates of depression, anxiety, and suicide. Loneliness among heart failure patients was associated with nearly 4 times increased risk of death, 68% increased risk of hospitalization, and a 57% increased risk of emergency department visits. The same report highlighting loneliness among vulnerable older adults, including immigrants, LGBTQAI+ populations, minorities, and victims of elder abuse. While we have all experienced what social isolation and loneliness feels like because of the pandemic, it's important that we not forget these feelings, as many people have been living with these sustained issues for a very long time. We'll one day be on the other side of this pandemic. However, isolation and loneliness may not dissipate for all. Again, if you are seeing these symptoms in those that you love, that you're providing caregiving services to, friends, family members, we really encourage you to share the Stay Well counseling line with them. No one should ever have to feel alone. So worry is normal right now, right? Yes, absolutely. Worry is normal now for all of us. The people you are caring for, the people in your family, your friends, all of us, worry is very normal. The stresses and changes that sometimes go along with aging, such as poor health, memory problems, and losses, can cause worry and anxiety. Under normal circumstances, older adults have cited being afraid of falling, being unable to afford living expenses and medication, fear of being victimized or being dependent on others, being left alone, as well as death. Many of these already present fears are now being exacerbated because of COVID-19. It's important to pay attention to these worries. If they're interfering with someone's ability to do everyday activities, eating properly, sleeping, reading, reaching out to friends and family, don't hesitate. A Stay Well counselor is ready to listen. We know that more than half of the American adults are reporting that their mental health has been negatively impacted because of the pandemic due to worry and stress over the virus. As the pandemic wears on, it's likely that the mental health burden will increase as measures taken to slow the spread of the virus, such as social distancing, businesses being closed, and shelter-in-place orders, lead to greater isolation and potential financial distress. Though necessary to prevent loss of life due to COVID-19, these public health measures expose many people to experiencing situations that are linked to poor mental health outcomes, such as isolation. Additionally, feelings of anxiety are increasingly common as people are fearful of themselves or loved ones falling ill and are uncertain of the repercussions of the pandemic. With the Stay Well Project, we want to help ease these feelings. We want to help offer resources that can help and allow older adults the understanding that we're here to support you too. For many people that are living alone and spending time alone during the day, I've heard older adults over the years say that they keep the TV on to feel like someone is at home with them, or for background noise. Some things to consider though. People age 65 and older watch TV an average of 47 hours and 13 minutes each week, which is a ton of TV. While many people aim to feel more connected when watching TV, it's actually a sign of disengagement from the world. Older adults watch more TV, but enjoy this less than people that are younger. Consider taking a break from watching TV and the news. Much of the news is focused on negative messages. While it's important to stay informed, the news can be overwhelming. Take a break, call someone, a family, friend, and stay connected. So we wanted to provide you with some tips because we know that worry and anxiety is something that many folks are experiencing. So relieving stress and anxiety is really critically important right now. Here are a few tips that you can see that can help. So staying informed and taking practical steps to protect yourself and loved ones. Get facts from trusted sources such as the CDC, the World Health Organization, local health departments, or the Michigan Department of Health and Human Services. Do not stay glued to the news, as this is only going to worsen the distress right now that you might be feeling. You want to engage in healthy activities. So getting 7 to 9 hours of sleep each night, trying to eat a healthy, well-balanced diet, refrain from smoking, not drinking more than 1 alcoholic drink per day or none at all per doctor's instructions, and finally exercising your body and mind. Meditation, walking, gardening, and doing some exercise routines in your home are all very beneficial to your mental health. It's important to make sure that you have at least 1 month's supply of prescription and over-the-counter medications you need to manage your mental health and other ongoing conditions. It's important to take all of your medications as directed by your healthcare providers. Stick to a routine as much as possible. You may need to create a new routine to account for perhaps additional family members that may be in your home and working from home, caring for grandchildren, additional cleaning, or other daily activities. You want to try to integrate some old and new enjoyable hobbies into your daily routine. Stay connected with family, friends, and other support networks, whether that's faith-based or hobbies. Having someone to talk to about your needs and feelings is vital for mental health. Make a commitment to contact at least one person through social connection, whether that be telephone, email, video conference, social media, if you have internet access. Consider asking one person to be your support buddy and have daily check-ins. If you're a member of a peer support group, stay connected through the telephone or video platforms such as Zoom. If you don't have a group or a person such as this, or would prefer to speak to someone outside of your circle, a Stay Well counselor is always available and always ready to listen. Try as much as possible to be positive and to relish in the simple things in life. So many people across the country are helping their neighbors and communities during this crisis. And after this pandemic is over, it's hopeful that we'll be stronger, kinder, and more connected to one another. So how do we stay socially connected and safe at the same time? This slide here gives us a few ideas of how to do that. Researchers have been warning and imploring the need for additional research and services for and about a loneliness epidemic for some time now, directed more at older adults. However, now during the pandemic, the concern is amplified and directed to everyone. We've talked a lot about negative effects of isolation for older adults and statistics that are really quite staggering. Let's talk about what happens when someone is engaging with others, of course, using safe practices of wearing a mask and physical distancing. Well, you're going to see improved mental health. When we're socially engaged, we're less likely to fall victim to mental illnesses such as depression. Social isolation is a key trigger for mental illness. On the contrary, you're more likely to have better mental health if you have supportive relationships with friends, family, and even neighbors. Physical health. There are so many physical benefits to your health that come with being socially engaged. To name a few, lower blood pressure. So research has shown social networks really can help to control hypertension. Also, we've learned that what is heart healthy is brain healthy and can help ward off forms of dementia. Cognitive and brain health. We tend to have higher levels of cognitive function with increased social interaction. There are a few items that the National Institute on Health shares to help prevent cognitive loss, and one of them is remaining socially engaged. Safety and security. Simply by being around others, you'll be more likely to live safely. Not only can someone help you if you've had a bad fall, but you can also lean on your community and circle of influence for a plethora of other non-ideal situations that may arise. Personal care and assistance. Someone will be there and will know that you're in need of help. Your community, whether paid assistants, family members, or friends, can help you with this personal care and attending to those needs. There are people that can assist with mobility, errands, and doctor's appointments. As we age, our mobility decreases and our independence can decline, which means we do need to rely on other people. This becomes increasingly difficult if we disengage and withdraw from social interactions. Help with technology. This really applies to all ages, but especially to seniors who struggle with a larger tech hurdle. Not all, but many. We can learn shortcuts and easy how-to lessons from other people within our social circles. When it comes to technology, simply having people around you to show you the way can make such a big difference. The state of Michigan has a grant called Get Set Up that works with teaching older adults how to use technology to engage socially and remain cognitively stimulated. When you're engaged with positive social interaction, you have an improved sense of purpose and belonging. So depending on how we prioritize our inner circle of influence, our sense of purpose and belonging can be greatly impacted daily by our social interaction. I like to remind people that their circle of influence can mean everything when it comes to living life aligned with your core values. Lastly, growth and learning. Growth and learning are two things that greatly contribute to your brain health and your sense of fulfillment, as well as they contribute to your level of social interaction. So take the opportunity to grow and learn within a community, a group, or a class setting with a friend. For those that are caregiving during a pandemic, this is a very challenging time for you, or watching the decline of a loved one. For those Americans that are full-time caregivers right now, their level of stress and responsibility is likely very high. Without the proper support systems in place to allow for respite and for the caregiver for time to care for themselves, they are at an even higher risk of medical complications than what they were previously pre-pandemic. For older adults that are also raising grandchildren, the worry about meeting all of their care needs while keeping themselves safe and able to care for themselves is really harrowing. The grief that has been witnessed firsthand by those who have a loved one in a residential care facility, the trauma this presents can be exhausting. Not being able to be with the person as they pass on can elicit years of prolonged grief without closure. Stay Well Michigan is here to help caregivers through all of their different needs and emotions as they have during this really challenging time. All of us have been and are being impacted because of COVID-19. This virus does not discriminate. However, there are some groups that are and will experience more hardships than others. It's imperative that all Michiganders know that they're not alone. There are resources to help and to assist in normalizing these feelings because they're shared, and at some point in time, by all Michiganders. We know that this virus isn't going anywhere anytime soon, and in the duration while we wait, it's imperative to have resources to help individuals cope. We've linked with 211, as has Griffin Place, who is helping to support and run our crisis counseling program. If someone is in need of additional resources, 211 will be utilized. If the person is in need of a warm handoff or additional supports and services, that will be handled by Griffin Place as well. We recently learned about a woman that had called and she was grieving her husband. Her husband had passed away from COVID, but she'd also been ill with the virus. When talking, the counselor was able to learn that she was in need of food. Despite her being embarrassed, the stable counselor was able to help connect this woman with the correct resource in her county to help ensure that she had enough to eat. These resources and being able to ask for help are so important. This is an unprecedented crisis and it presents unprecedented risks to the rights and safety for everyone. But by working together, we're going to get through this. Thank you so much for your time and attention throughout this presentation. I really value that you've taken the time to learn more about this program and hope that you will share the information with a close friend, family member, or another organization that you may be affiliated with. In addition to that, I encourage you to use the information for yourself as well. If you have further questions, please do not hesitate to reach out to me directly via email. I would be happy to share more information with you. Or you can also just call the Stay Well Counseling line. The number is presented here. You'll also be able to find it on our webpage. Thank you again for your time and attention, and stay well.